Can you and should you have cosmetic facial surgery at the same time as doing a parotid surgery? I'm Dr. Babak Larian from Center for Advanced Parotid and Facial Nerve Surgery. That's a very good question. The plastic surgery or the cosmetic surgery procedures that we're talking about in specific are facelift and neck lift. So let's talk about what's involved. As you know, the facial nerve has varying anatomies. This is one shape of the facial nerve, which is going to many different spots on the face to move the muscles of the face, but it can look different in every person. And in fact, it does look different in every person. So the surgeon doing the parotid surgery should have a lot of expertise and be familiar with the parotid and the facial nerve anatomy. Now, when you look at the cross section of here, the parotid and the facial nerve branches, so if you were to look at the cross section here, the parotid gland would look something like this. And the jawbone that you have the impression of here would be in front of it. And the facial nerve would enter in the gland and come forward like this. So it would look something like this. This layer is the skin, fat under the skin, and then you have the parotid gland here, jawbone, muscles over and underneath the jawbone or deep to the jawbone, and this is the facial nerve coming through. Now, the one thing you also notice here is this other layer between the skin and the parotid gland. This is called the SMAS layer. The SMAS layer comes from here, there, goes to your laugh lines, and it also comes down to the neck and is attached to muscles of the neck that you do this, move the neck a little bit. It doesn't have much of a purpose in human beings, but it helps other animals move their neck and flick off flies. In any case, the nerves are deeply involved with movements of all the musculature of the face and of expression. So the expression of your eyes, your smile, what you're trying to say comes through with the functioning of this nerve. So this nerve is really important. It is deep in the parotid gland here behind the jawbone, and then as it gets further forward in the jawbone, it exits the parotid gland, it gets immediately under this SMAS layer and skin. So it's pretty superficial once you pass this area. This is the parotid, right? So from here onwards, the nerve branches are very superficial. So traditionally, if there is a parotid tumor and you have parotid surgery, what they do is they elevate the skin layer, right? And remove the parotid along, let me draw it back, along with a cuff of normal tissue, not the nerve, and the SMAS layer, right? So you can see that here. The skin is lifted, the parotid tumor is removed with a portion of the parotid gland, the normal salivary gland, and the SMAS layer. And then most cases, no reconstruction is done, and the skin is laid down on the area of the tumor removal, which is why most people who have parotid surgery will have a little bit of a divot in that area. If someone already has this type of surgery done, to go back to do a facelift, which requires us to take this layer here, the SMAS layer, and pull it backwards. And that's what gives the lift on a facelift. It's that layer under the skin that's really thick and hardy and can be pulled back, right? So after you've had a regular parotidectomy, this layer has been partially cut, and it's also not over the parotid gland anymore. It's further forward, right? The other problem with this is that if you go back and you try to get under the skin, there's a chance you may damage the facial nerve because it's so close to the skin, because there are no barriers between the nerve and the skin of the face, right? So that can be a big problem, because just trying to get under the skin to do the surgery can cause facial nerve injury, right? So the way I do parotidectomy is, I call it preservation parotidectomy or microparotidectomy, is that I preserve this SMAS layer, and I use it for the reconstruction actually. So if you have a large tumor like we saw before, I raise the skin and the SMAS layer, and then I remove the tumor. If I need to do a big reconstruction, I bring a portion of a muscle from here to cover the nerve. So in this scenario, a person can come back years later and do a facelift if they need to. But if we go back, you can see that this SMAS layer has already been raised. So this is the ideal time to do a facelift or a neck lift because that layer has already been lifted. It's ready to be pulled back. So a lot of the surgery that needs to be done for a facelift is done by the parotid surgeon. And at that point, once the surgery is done, once reconstruction is completed, the facial plastic surgeon or your plastic surgeon can come in and actually pull the SMAS layer and the skin and do a facelift very easily and very safely. And that's the key. The safety of the procedure is best and ideal at the time of the parotidectomy because your facial nerve is all dissected and preserved, right? And the SMAS layer is ready for you to do the lift. So the job is halfway done. Easy to do a facelift right from that point forward, okay? Anyways, if you have a smaller tumor, same thing. If your tumor is small, a smaller procedure doesn't require a muscle flap. We can bring the two edges of the parotid together, suture it together, but again, that SMAS layer is preserved, lifted, and ready for a facelift. So to do a facelift or a neck lift at the same time as a parotidectomy is actually the ideal time to do it because half of the job is already done and you don't have scar formations from previous surgery, right? To challenge the way we create symmetry and harmony, but the way plastic surgeons need to make symmetry and harmony when they're doing a face. Hopefully this video was helpful. If you did find it helpful, please like us, subscribe to us. If you need more information, leave a comment, let us know what you're looking for. But you can also get more information at our website, parotidmd.com. There's a lot of information about parotid surgery, parotid tumors, and all sorts of issues related to it. Be well.